All right, good afternoon, ladies and gentlemen. This is the Vermont State Senate Committee on Institutions. I am Joe Benning, the chair of the committee. Apologies for us having technical difficulties. We were due to be on at 1:30, but we are here live and in person. Including myself, we have Senator Mazza from Grand Isle, Senator McCormick from Windsor County, Senator Ingalls from Essex Orleans, and Senator Parent from Franklin County. Lori Emerson, I understand you're going to start us off in the conversation of mental health during COVID-19. Welcome.
Thank you so much, Chairman Benning and members of the Senate Institutions Committee. My name is Lori Emerson, and I'm the Executive Director at NAMI Vermont. And I want to thank you for allowing us to provide testimony to your committee today for Mental Health Advocacy Day or Week. My comments are going to focus on two areas, mental health and COVID and corrections, and mental health crisis response and diversion from the criminal justice system. So this year's Mental Health Advocacy Day was held virtually, and we brought together over 250 advocates and organizations on February 1st. So if you weren't able to attend, I did provide a link in my testimony and hope that you can take the time to look at the recording and view the day's events. So I collected testimony from somebody that is in corrections or was in corrections, and I just wanted to share those thoughts with you. One of the worst experiences anyone can ever have is to be locked up in corrections, especially during COVID-19 pandemic. Imagine what it must be like to enter the correction system and be quarantined for 2 weeks. This means isolation and solitary confinement when you first arrive. If you leave the correctional facility for court or emergency medical situations, you need to quarantine again for 2 weeks by yourself in isolation. Once admitted to the mental health unit, you're doing your time in a locked 8x10 cell with a roommate. Half of the unit is allowed 1 hour a day to use the common area and staying 6 feet away from each other where they can at least interact with others. Cloth masks are supplied to the inmates and then washed and reused to whoever gets the mask next.
I think we have lost Lori.
No exercise time, not able to go outside in the yard, not able to enjoy any hot commissary items such as coffee or other food that needs to be microwaved. Only ready to eat items. No in-person visits from family or friends. On a positive note, what is going well in corrections? There's a sign-up program called Open Ears that is one-on-one peer support for 45 minutes once a week. It is a wonderful program that helps people connect with someone who understands, who is also an inmate. Although there are no in-person visits, there is a rotating schedule of using the phone, and inmates are provided with tablets. The new medical care team is a great improvement. Staff are there in person if needed, and people are doing hard time these days in corrections. The second part of my testimony will focus on mental health crisis and diversion from the criminal justice system. When mental health crisis happens, it should get a mental health response. The handcuffing and pepper spraying of a 9-year-old girl in Rochester, New York last Friday by local law enforcement after a crisis deserved help, not handcuffs and pepper spray. NAMI believes that responses to situations like this family's crisis should be met with well-trained mobile crisis that provide the de-escalation help and support people need. These teams should include peer and family support advocates. A police response to a mental health crisis is not the answer. Police are trained to respond to criminal encounters. We've seen countless times when police respond to mental health crisis. They can escalate a situation, and the likelihood of criminal charges being filed, or worse yet, someone is injured or killed. We need to avoid these encounters by having alternatives to responding to mental health crises. Many families or community members do not know or understand what options and alternatives exist within their community other than calling 911 or bringing their loved one to the emergency room, which should be a last resort and only if someone is in immediate danger to self or others. Last year, federal adoption of 988 as a 3-digit number for mental health, substance use, and suicidal crises, which will be effective nationwide by July of 2022, provides a path forward to accelerate better options for communities across the country. NAMI Vermont advocates for state and local crisis systems that combine well-trained call centers with mobile crisis teams that includes peer support to meet people where they are at, and crisis stabilization programs. Other states are creating legislation that will ensure a well-funded system is in place once the 988 phone number is active. Vermont needs to ensure the 988 number is comprehensive and addresses mental health, substance use, and suicidal crises, and not to serve only as a suicide prevention lifeline. We can set up call centers and crisis teams, but what's next? Where do people go to get immediate help? Do we continue to bring people to the emergency room? No. We need to invest into crisis stabilization programs, a program that allows drop-ins, that allows people to stabilize within 24 hours in a home-like setting, and then are referred back to the community and followed up on. Another example of a crisis response model is from Eugene, Oregon. The CAHOOTS program has been in existence for 31 years. It's a non-police, trauma-informed mobile response to children and adults in crisis. And last year, out of a total of roughly 24,000 CAHOOTS calls, police backup was requested only 150 times. As Vermont builds a crisis response systems that includes mobile mental health crisis clinicians, it is critical that we also include people living in long-term recovery from mental illness to be part of the design, planning, and workforce. Some people respond better to the peer approach. Every community and individual has unique challenges and needs, and each response needs to be tailored to fit that local environment and person. Additionally, NAMI Vermont and Team 2 Vermont are scheduling screenings of the Ernie and Joe Crisis Cops documentary that includes an interactive panel discussion with different communities in Vermont. And I would highly encourage the Senate Institutions Committee to attend the next screening in April. The documentary follows two San Antonio police officers from the mental health unit and how they approach crisis intervention by de-escalation and diverting people from criminal justice systems. So I'll forward that information to you once it becomes available, and hope you folks can attend. We request that the state and your committee continue to establish alternatives to mental health crisis intervention and crisis stabilization, which will help diversion from the criminal justice system. Thanks so much for listening to our comments.
Thank you, Lori. Committee, any questions? Peter and Julie, who would like to go next?
Joe, Senator, Chairman.
Yes, Russ, go ahead.
One of the things that's always been helpful is if you could ask Ms. Emerson, Executive Director Emerson, how she fits into the Capitol bill, or does she?
Lori, can you answer that question?
So funding for NAMI Vermont?
Yes, ma'am.
Okay, so our funding for NAMI Vermont includes a grant from the Department of Mental Health. It also includes donations and, no, Peter? Oh, okay. It also includes donations from the community, and we're also funded through other grants as well.
Okay.
So I probably should have given this introduction, which I usually do, but with the technical difficulties, I was a little off base this afternoon. This committee deals primarily with the brick and mortar questions, and you're touching on areas that are, for the most part, policy questions, which generally in the Senate are handled by either judiciary or health and welfare. But some of your comments are dovetailing with our responsibilities, which include what facilities are available to deal with mental health. Keeping that in mind, we have new committee members who are learning who the players are for the first time, and we're trying to make sure that everybody who appears before us has some basic understanding presented to the committee about who you are and how you might fit into the capital bill. With that in mind, any other questions for Lori? Okay, Peter and Julie, I don't know which one of you would like to go first.
I'd be glad to go next.
Okay, welcome.
And I did prepare some slides, and some of that is like, who are you and what are designated specialized service agencies? But I can try to go through them quickly. And at the end, I was going to talk to you about our capital needs. Does that sound okay?
That's perfect.
Okay, so I'm going to try to share my screen. So far I'm disabled, so I need Denise to enable me.
There we go.
Okay. I'm still disabled. I think that this
Denise,
is
if you
just the
make-
day for technical difficulties, huh?
If you make her a co-host. If you right click on her, you can make her a co-host and then she can share.
Say when. All right. There we go. Thank you. So my name is Julie Chesler. I work as the Executive Director of Vermont Care Partners, the Vermont Council end of it. Just to tell you what Vermont Care Partners is, it's a statewide organization. We provide leadership to designated and specialized service agencies that provide, they're nonprofit community member agencies, and they serve people with developmental disabilities, people with mental health conditions, and people with substance use disorders. This map just kind of shows you the areas that they cover. The designated agencies have somewhat different responsibilities than the specialized service agencies. They have a zero reject responsibility to meet the needs of their communities, whereas the specialized service agencies provide more specialized services and supports. So the core functions is to provide those comprehensive services. We have high needs mandated populations and crisis services to all Vermonters. Each agency has some uniqueness to it depending on its own community and the regional needs. And all the work we do is done in collaboration with healthcare partners, schools, human service providers, employers, housing agencies, shelters, law enforcement, Blueprint for Health, you name it, we're in our communities. As a system of care, we do maintain core competencies and standards of care, and we contribute to the healthcare triple aim. This is just a quick overview. We actually serve 32,000 Vermonters a year as clients, but we touch the lives of more Vermonters because not everyone we serve actually becomes a client, but we do health promotion and outreach, disaster response. We do a lot of reaching out to our communities beyond the people we serve as clients. We have 5,000 staff, and we also have contracted workers. So people in substance use disorder services total over 3,000. 8 of our agencies contract with ADAP. There's nearly 4,000 people who receive developmental disability services. Our crisis services that are 24/7 serve over 8,500 people a year. We serve over 7,000 people in adult mental health services, over 11,000 children. And as I mentioned, we have a lot of community outreach, education, response to disasters, and we use peers for services. Just to be clear that this is not just about people coming in for therapy. All the agencies employ clinicians in primary care settings, although not all primary care doctors have us in them. We're in over 90% of supervisory unions. We provide services in people's homes and in different community settings, as well as in our offices. We feel good about our services. We think we're pretty accessible. 67% of the people we serve are able to be seen in 5 days, as at least for their initial appointment. And then within 2 weeks, we serve almost 2/3 of them. 90% of people say the services were right for them. 87% say the services made a difference. 84% of the people we serve say their quality of life improved, and 90% say they feel respected. But we had this little thing that happened this year, COVID, right? So 40% of Americans say that they are feeling struggling with mental health and substance use disorders. This is much higher than it was. 11% are considering suicide. 13% have either increased or have started using substances. Anxiety and depression affects almost 1/3 of the population, and more than 1/4 of people are feeling trauma and stress-related disorders. So that's kind of the national picture. If you ask the designated agency directors what they're seeing individuals and families under stress. It's housing, it's food insecurity, job loss, isolation, loss of loved ones, you name it, you know it, your neighbors, your family, everyone is experiencing it. They're experiencing trauma, and the trauma is going to have lasting effects way beyond when everyone has their vaccines and we're safe to go out without masks again. And it's affecting more people, and the people that we have been serving, the acuity of their needs is higher. Our staff are also under a lot of pressure. A number of them just said, that's it. This is too hard. I'm retiring. I'm not doing this. This is too much. Some have had to go on family or medical leave because of people in their family whose immune systems are compromised. So the staff that remain have been really stretched thin. We're asking them to do things like use PPE. If they have people in their cars, they have to do all this cleaning, and they have to, deal with the testing. And they're taking risk of serving those at risk and filling for coworkers. This has especially happened in our residential facilities, where we've had a number of times where people have developed COVID in our facilities. Now, fortunately, our facilities are small. We had a 4-person facility in Bennington where every single person there developed COVID, and the staff developed COVID. And at first the staff said, oh, we'll just stay, we already got it. But they were sick, and so they couldn't stay. So other staff had to come in. So it's been tough, or if we have someone in the crisis bed, it was COVID, then you can't fill the second crisis bed. So our staff have worked really hard, and I want to thank the legislature for recognition of the healthcare workers out there. What we're finding is we don't have as many staff as we need. We have nearly 500 vacancies out of the 5,000 positions. We've got a growing wait for outpatient services and urgent care. And we're feeling we don't have enough nursing services, case management, and crisis beds. And those crisis beds are not just for adults with mental health crisis, but also for elders and people with developmental disabilities that are really feeling that isolation and stress. So that is one of the things we could use capital investment in is crisis beds. I do want to say that we're doing a lot of We've created warm lines to combat social isolation. We're finding ways to get people food, medicine, educational and activity supplies, and we bring them to people's homes. We've distributed tablets, even help people access Wi-Fi, which is a big issue. We have had to temporarily house some people in hotels who are in crisis because, as I mentioned, we don't have enough crisis beds, and sometimes a 2-bed unit only serve one person, especially if someone has COVID or has been exposed. We are doing more outreach to individuals and families, especially those who have been in hotels and motels where I think you've read in Digger that the conditions there are not great. We've been doing lots of virtual telehealth and support services by Zoom and the audio only, and I'll go back to that in a minute. We've also been doing a lot of public education. Hopefully you've seen some of the COVID Support Vermont that Vermont Care Partners has been working on with the Department of Mental Health to help people have coping skills, to have outreach to crisis counseling and supports and education and ideas about how to maintain wellness. And we're doing more wellness activities, not just for the people we serve, but also for our staff and communities. So we've really mobilized to address COVID. Before COVID, literally, we had provided only 28 telehealth services to 24 Vermonters between last November and February. So when COVID hit, you can see we just really increased that service. It's been really critical to us be able to provide supports to people in their homes. 80% said the services were helpful. 60% said it's actually as good as in person. You know, and it really varies. For some people, it's not as good, and for some people, they prefer it. One thing we have less of is no-shows. So what kind of support do we need from the legislature? We need investment in services. I mean, I know this is not what you do, but you are, as senators, you're always involved in everything. We need investment in our workforce. With all those vacancies, it is a big issue, and we've been having struggles because we have not been getting rate increases on a regular basis like state employees, and we don't have the cost shift capability of health providers. So we've really been close to level funded for quite some time, and our salaries are really low. So when we find someone to hire, very often they turn us down because we can't offer them significant salaries. We also need to develop more educational opportunities for our workforce and increase some very specific services to elders, the homeless, to improve outreach and serving people in the criminal justice system. And we do support the justice reinvestment initiatives. But we do have one-time investments, and we realize that that is where there's more resources this year. We could use one-time investments in things like the work with the hotels, the case management, helping people before they get on SSI, doing trainings, investing in the stabilization programs, especially when we can't have them at full census because of COVID, and addressing some of the one-time expenses like the air systems, equipment, facilities, and testing. So specifically, our finance directors reviewed what their needs are in capital, and we need new facilities. We need facilities to house people. We're actually one of the major housers of low-income people in the state of Vermont. There are people who are homeless, elders in particular, because many times they don't necessarily need nursing home care and they get stuck in the hospital because there's nowhere for them to go. Most nursing homes aren't well equipped to serve people, elders with psychiatric needs, but we could develop specialized programs, so we'd actually need to have the residences, the crisis beds, and office space because of COVID right now is more challenging. We need to be spaced out more. We have a great need for renovation and upgrades. There's a lot of safety risks out there. ADA, the handicapped accessibility is, we're not all there the way we should be. HIPAA compliance means that we actually need to have soundproofing between where we serve clients, and we don't always have that. We need better air filtration systems, and for accessibility, we need the elevators and chair lifts. We're using a lot of old buildings that don't have that. And because we've been under-resourced for so long, we really need investments in maintenance and repair. Roofs, windows, doors, flooring, carpeting, ramps, boilers, kitchens, you name it, we need it. So we have significant capital needs, and I know that you've been focusing on state programs. Woodside, we support. The Secure Residential, we support. But we are a big part of the mental health service system, and the more that we can support people in the community, the fewer people would need inpatient and the higher level residential care. So we think it's worth the investment. I know it's an unusual ask, but I hope that you would consider it, and we certainly could give you more detail if you are interested in doing that. And I can see if I can figure out how to stop screen sharing. Did I do that? I don't know.
I still have it on the screen.
Stop share. Okay.
There we go. So Julie, the capital bill begins in the House, as you know. I don't know if you've approached the House. I don't know if you actually had anything in the governor's recommend. But the upshot is the conversation, if you're asking for money, would be starting in the House. And then we would see what happens when they send it over to us in March. We'll keep your thoughts in mind. We can't obviously make any promises, but your challenge is to talk to the House first to see if you can't squeak in under the tent, so to speak, to try to get something from the Capitol bill.
Thank you.
Committee, any questions? Seeing no hands. Peter, welcome.
Thank you, Senator, and thank you all for having us here today. And I'm Peter Mallory, and I'm Vice President in charge of Government Relations and Community Outreach and Advocacy for the Vermont Association of Mental Health and Addiction Recovery, otherwise known as VAMHAR. And I really am here mostly to back up Lori and Julie. I know you're pressed for time. I don't have any immediate capital requests, so I think Julie covered that well, and I support those and will do what I can to help her in the House. Otherwise, it's been a really good week for mental health and mental health awareness. And I feel that the three of us have done this now for what, Julie, 6 or 7 years, and I think it's working better and better. As Laurie said, we had 250 people on Monday, and that is a tribute to virtual success, if you will. I may be back to you, and I'll talk to Denise if that's all right, because week after next, we're going to do work on recovery issues, and there might be some capital ideas there that I'll take up with Representative Emmons, but might be interested in having 10 minutes at some point on that. And I've had Tracy Hawk in from Rutland on her program a couple of years in a row, and you've been very gracious to hear her, but maybe I'll try to squeeze her into judiciary this year, so you have a little more time for other things.
Okay.
So that's really all I've got. I think Julie and Laurie have covered the bases real well.
Yeah,
Well,
we
I
appreciate this opportunity.
Sure. I appreciate you guys coming in. Our committee is made up of 3 new members, one who's a brand new legislator. And in this new world of YouTube presence, there are probably people out there in the public. I don't know how you check and see if anybody out there is actually watching, but should they be, the basic introductions are really important for people to know all about you. In the event that the Capitol bill comes over to us, and at that point in time, there is a monetary request, we would probably have you back in. So that's after crossover. But that's the point where you'd probably be making a play for money if that happens to be planted in there first by the House. So now's a great time to be talking to Alice and moving forward from there.
Okay.
So
Will
thank
do.
you very much for coming this afternoon. We hope you all have a great day.
Thank you
Great
for
to
your
see
time.
you all.
Appreciate it.
Take care.
Soon. Thank you.
Bye-bye.
Catherine, just to give you a heads up, and committee you as well. Catherine's coming in to give us a basic 101 plan on how we deal with the Capitol bill. Catherine, I have another obligation at 3 o'clock, so I think you could probably get in there, I'm sure. And
Yes.
Becky, I know also was planning something. If we get to 3 o'clock, I may have to cut off who's ever still
That's fine.
talking. We can reschedule you.
I think that's fine. And I talked to Becky. I think our plan is to just talk. We don't have a presentation. We're just going to walk through some of the basic structures of the Capitol bill and how it works in the process for the committees. And we can come back and talk in more detail about any of it at any future point in time. Does that
The
sound
committee,
okay?
yeah, the committee should probably know that Catherine and Becky are pretty much at our beck and call at any point in time we decide we want to pull them in. So
They run everything for us. So we don't have
yes, they do.
And
Oh,
I also I do also have an obligation at 3, so I will have to
Okay.
jump off at that point.
so we could talk really fast too, if
Yes.
that works.
True.
What I thought I'd start by talking about is just reminding you all that in terms of debt for the state, there's a committee, the Capital Debt Affordability Advisory Committee, that recommends a limit for how much debt the state takes on. And as long as that recommendation has been going around, the governor and the legislature have always abided by that limit. And so this limit is it's 123 million for this next biennium. And in the capital bill, you authorize the treasurer to bond for that. That's an important piece of the capital bill. It's actually sort of after all the appropriations, it's buried in the middle of it, but it's a very important section because it allows her to go out and actually bond and borrow for these projects. And I'm just going to walk through sort of her piece of it first, and then we'll get back to the specific projects. But every year, so last biennium, the bill was passed, and there's all these projects that are on the table. And in the process of bonding, the treasurer doesn't just go out and bond for 123 million. She doesn't want to borrow unless there's a project that needs cash. There's no reason to be paying interest on something that's not moving forward. So the finance and management, which is part of the executive branch, asks all the projects that have been appropriated capital funds, how much are you going to need for the next 12 months? And they say, and some projects, they know they're going to take more than a year. Some projects think they're going to happen that year, and some projects know they've been delayed because of permitting or other issues. So they give that information back, and then the treasurer takes that information and says, okay, well, we thought there might be, I don't know, $60 million in projects this year, but in fact, only 50 million are actually ready to move forward. And so that's what she bonds for. And it's, actually not just about 1 year, because there's been all these prior years of capital projects as well. But I just want you to remember that you authorize her to bond for a certain amount, but she doesn't borrow it unless there's going to be a cash need. And it's not perfect, because projects are not perfect, but I just wanted you to have that in your thought. Becky, did you have anything you wanted to add about that?
No, I think that that covered it well. I'm trying to think that each year there's usually a section on what in the capital bill on what was authorized for bonding, but never. Sorry, I forget how we phrase it. It's authorized but never used.
Unissued, maybe?
Unissued, yeah. So usually there's a section in the capital bill that has an amount of money that seems like it's adding to the bottom line of what's available, but it's sort of what Catherine explained, that was just capacity that those at the time that the treasurer hadn't issued that amount of money yet. So sometimes it seems like there is, will be like 133 million available in the bill, but it's not like additional capacity.
So if anybody has any questions, I'm happy to answer them. Becky and I can answer them, or we could go on to more of the project appropriations process, if that makes sense.
Yeah, committee, if you happen to have a question, don't hesitate to chirp up.
That's right. So just like the budget bill, I think the governor's proposed a capital budget. The House is going to respond to that, and I would say likely be different than the governor, and that it'll come to the Senate, and the Senate will likely make some changes also, and then you all work it out and come to some agreement in the end. I will say that two things. One is that I think every one of those steps along the way, everybody will be allocating the funds that are available in that year and saving, and also for the second year also. The interesting thing that happens also is there are projects in the past, and the governor did this, projects that finished and didn't spend all their money, and those monies are reallocated. So that's the governor had some funds that he had found that he put in his proposal. The House may find some additional, the Senate may find some additional. It's not usually that many right now. It used to be more in the past, but things have really been cleaned up. But that does provide, if there's a project that decides it's not moving forward, and those funds then become available for you all to spend on projects. So that's one reason that you will see the governor spent more than 123 million, because there was I want to say a couple million actually of reallocations that he found. So that's one piece of it. And then, the projects I think you will find are organized by agency or department. And generally, the clean water is one exception, but the rest of it is really, you have the buildings and general services, which is a big part of it. And it's a big part of it because they do all the state building maintenance, and they do actually manage projects for other entities as well, sometimes. And then you'll see as it goes through that the other projects, there's Agency of Human Services, there's I don't know, Becky, help me out with judiciary. Then there's the
Commerce and
community
development.
grants, right?
Yeah.
And the veterans home. And I think you've started hearing from some people about, and you'll hear more, I'm sure, this ag fairs. When you think about these projects, there's some that show up every year. There's ongoing major maintenance that buildings and general services does for state buildings. It's a big number, and it's something that needs to happen every year. Communities grants have been funded every year. That's another one. There's the clean water, drinking water projects, which actually match federal funds. Those show up every year. So there's sort of the ongoing projects that you will see year after year. And then there's another group of projects, which are, I would call, more unique projects, like the Middlesex replacement, where it's not something that happens every year. And you're not building a Middlesex replacement every year. Or IT projects. The Capitol Bill has funded some IT projects in the past also. So it's a mix of ongoing, regular work that you will see every year, and then thrown into it are unique projects. And there's always could be a state police barracks. Anyway, so I don't know, Becky, if you have anything else to add about that, but that's sort of how I think about those two groupings.
Yeah, and I guess just from the sort of legal perspective of it, that the Capitol Bill is the language is funny in that a lot of it is in session law, sort of going along with what you're saying, Catherine, that because it's similar to the budget. They're like one-time appropriations, even though you'll see this appropriations to the same projects
You may
every
want
year.
to talk about what session law is.
Right. So session law is it's law. It's just it has the same effect as what is in statute, which we call our green books, which would, if you were in the committee room, you would see on the shelves. Except we use it for more like temporary projects or temporary committees or things like that aren't sort of permanent ongoing things. So for example, in 20 years, you're not going to see in statute that there was an appropriation to BGS for, the Middlesex facility. But I think that the fact that most of the Capitol Bill is in session law, it is not as easily, you can't easily navigate it from year to year as you could if it was in statute. So it takes a lot more sort of digging to figure out what was done in the past. So there are projects like Middlesex, for example, where there are probably appropriations and language in the Capitol Bill that are tied to that project over the years. And it just sometimes takes a lot of piecing together of what the committee had done in the past to figure out sort of how they got to where they are today. So I don't know if there are any questions on that, but I think that comes up a lot in the Capitol Bill of trying to say, like, I think like 5 years ago we did something with this project, and it just takes a little more sort of digging around to figure out what it was.
Okay.
So the other thing I guess I was going to discuss was this concept of funding projects, and you are borrowing, and ideally you would be using that borrowing capacity to get work done and as fast as possible. That being said, there are some very big projects that are out there that are on your plate, and the legislature sometimes chooses to fund those over a period of years. And I'm trying to think about the one that is well, Cherry Street's a complicated one, but because of just general not figuring it out. But so you may in fact bond, you may assign a certain number of, I don't know, $2 million to a project, knowing that in fact it may not get spent for another year or two, but you're going to be doing 2 million a year, because if you put all of it in one year, you would not have any capacity to do some of the other things you want to do. So there's no perfect answer. It's a decision, and it's a trade-off that you all make as legislators and the governor, trying to figure out how much of it do you fund all at once when it's absolutely needed, and how do you allocate costs over time. And so on some of the bigger projects, you will see the funding is parsed out more over time, and so it doesn't always get used immediately, and you know that going into it, but those are the choices you make, because that also allows you to budget for it over time and not eat up all the capacity in 1 year on one particular project.
Throw you a curveball here. If one of us represented a small town that was having problems with a wastewater facility, is there a way for that town to get funding through the capital bill process, or what are their options?
So through the capital bill, there's the municipal wastewater loans from the Clean Water State Revolving Fund that is administered by the Department of Environmental Conservation. So I guess Eric Blatt is the person who could come to talk to the committee about that. But they have there's a program set up that does have an ability for municipalities to apply for low interest loans that I think the interest rate tends to be sort of over time built into the cost of the construction project. There is, I think, a priority list for how those loans are given out. So I think he would probably be the best person to talk about that, but that would be the process through the capital bill.
I'm sure we'll be having some of those conversations as we go farther along. I only threw that out there because we have new committee members that may not realize they have the ability to come and say, hey, is there money available for X, Y, or Z? But that's an example of what we would be talking about should you happen to have that come up on your plate, committee members. I sort of cut you off. Sure, go ahead.
Yeah, if I might follow up on that. You know, the other thing which I know Senator Mazza was on the institutions committee, maybe Senator McCormick, but the institutions, the capital bill has changed over time, and it's set up grants and other programs to try to not have the capital bill directly appropriate in line items for specific projects. There's a much more structured system, so it's not.
My district, your district, that's right. Yeah.
Right. There was people sometimes call it the deli section that used to exist, where people would funnel money to different pieces, and that is has changed from what it used to be. And there is a grants program, and Becky talks about the grants program for clean water, but there's also the communities grant programs. So there's a lot more focus on shifting specific issues into some kind of structured program that is less at the, less about whether or not you can get your town has the power to get the particular line item in a bill. I don't know, Senator Mazza, if you want to add anything to that. Since
no, there was the days like courthouses, they'd get this, they'd get that. And now there's allocations, and there's the historical society, which they distribute to different local historical projects. And it goes through a system, and you apply, and you meet criteria. It's just great. I love it, because no one has any influence by being on the committee, so to speak, and that's the way it was for many, many years. And it was kind of frightening, because, it was not done right. It was done. Now it's done systematically. You apply, you present whatever your wish the town does, or the historical, or the sewer projects, and they go through a process, and at least it's treated fairly. Everybody's equal.
So there's no way now to get any more Senator Mazza buildings out there, is that right?
I wish I had some, but I can't tell you there is any. I wish there was some, but I don't wish there was because I never got on that bandwagon, and I would never do it. And that's it.
Senator
Actually-
McCormick. Yep.
Yeah.
Dick?
Senator Oluzzi was very generous during the
His district.
Delhi section days.
Yeah.
Well, I tended to back him, so he was generous to my district as well.
Oh, that's right,
And then-
but that's not the way it should work.
I know. And Senator Mazza and Senator Cans hated everybody who wanted money. So it was really all up to Ann Cummings. She decided the whole Delhi section.
So Russ, if you haven't figured this out yet, you got a lot to live up to with Vince.
Yeah,
He probably knows Vince quite well.
quite well.
Quite
He
well.
calls me. He calls me 3 times a week.
There you go. There
Yeah.
you go.
Sorry about that.
Ask him how the Deli section worked.
I'll ask him. I can't.
Say, Mazza and the committee want to know how the Deli section works.
We will have that conversation today.
Right.
You plan a little time. He'll give you a list of buildings that he managed to get paid for.
Oh no, I hear about I hear about all his accomplishments every time we talk.
I've said this many times, and I'm sorry to have to say it again, but I was reporting part of the Capitol bill, and we had it all done in the afternoon before. In the morning, I get out to report the bill. I look at it, and it's been rewritten overnight. And I'm saying, I never voted on these issues. Well, Vince had rewritten the bill overnight, and he was great at that. He was a better drafts person than most of the draft people. But and I'm reporting things I never heard about before. But that was Vince.
Another way that the Delhi section worked, or just the Capitol bill in those days, Governor Dean would make front page above the fold denouncing Senate institutions for how reckless we were being with money. It was the craziest capital budget he's ever seen. But then when the time came to give out the checks, Governor Dean gave out the checks.
With the newspaper photographers right there.
Right.
Yeah.
All right, Catherine, I'm approaching the bewitching hour here.
I think we're good. That's the, we can do more in detail on anything you all have questions on, but that covered everything I was coming. Becky, did you have anything else?
I guess I would just say on the grant programs, we do have the sort of set of the Section 5 or Section 6 building community grants, but over the last few years, there have been other ones that are not in that sort of group that continues every year. I'm just thinking like the 911 grants, and then there was a school security grant program. So over time, the Capitol bill has done others outside of those particular grant programs, but it is not the Delhi section anymore.
Okay, somebody needs to get fed, so she's gonna start shredding me in a moment. We will see you guys all tomorrow. Thank you for coming along. Denise and Sean, if you could hang on for a minute. We'll see the rest of you tomorrow.
Chairman,
Yes, sir.
I'm going to have some internet connections going on here tomorrow. I'm going to do my best to make sure that I don't have any disruptions, but I'm going to let you be aware of just in case that does happen. But they're
Okay.
upgrading my internet, but I wanted to make you aware.
Shoot me a text, Russ, if you have any problems.
I will. Thank you.
Okay.
Yep.
Denise and Sean.
Yes. Senator, how
So
are you?
did we figure out what happened initially that we all ended up with different ways to connect?
Just for the record, we're still live on YouTube.
Oh, yes, we should take ourselves off of YouTube. Thank you for that.
Sure. So Denise, if you can go ahead and